ACSM Career Spotlight webinar on careers in health promotion and public health. I'm Heather Turner at the ACSM National Center, and we're excited that you're able to join us for the 6th event in our new Career Spotlight series for students. In order to keep background noise at a minimum, we will mute all phone lines during the initial presentation portion of the event. However, we'll leave plenty of time for questions and interaction at the end. There are 2 ways to ask a question. The first is to raise your hand using the hand icon on the left side of your toolbar. If you select this icon, I will unmute your audio line so that you can ask a question via the phone or your headset. If you plan to ask a question over the phone, be sure you enter the audio PIN number that is in the audio section of your toolbar. You can do that at this point if you have not done so. You may also type your question in the question portion of your toolbar, and I'd be happy to read that to the rest of the group for you. This event will offer 1 ACSM continuing education credits, and following the session, the individual who registered at your site will receive an email with the CEC information as well as a link to a brief survey. We ask that you take just a few minutes to complete the survey because each survey response is reviewed and used to plan future offerings. Now, let me introduce today's speaker. Mary Cruzy is president of Health Source Solutions. She has been in the health fitness field for 22 years, having spent 17 of those with Park Nicollet Health Source, which as of last April is now Health Source Solutions. Mary consults with companies on the design and implementation of comprehensive health promotion initiatives and leads a talented team in developing innovative programs and strategies that engage employees in making healthy lifestyle choices. ACSM greatly appreciates Mary's willingness to share her knowledge. Mary?
Thank you, Heather, and welcome everyone. Well, the overview today, I'm going to spend time talking about the types of jobs in health promotion, certainly about professional skills that you may want to consider as you're looking towards this career. If you're ready to step out of the door and into an internship, I'm going to talk about that. And I'm going to leave plenty of time for questions. So start writing questions soon. As we look at the field of health promotion, really, and preparing yourself, you really want to think about what are the unique things that you would bring to a work site, and how are you going to keep yourself or have yourself step outside of everybody else in this field, or what I'm going to call the zebra in a pack of horses. So as you look at this, you need to think about the competition that's out there, and you can look at that competition with the classmates that might be next to you or the other people in the room, if you're doing this as a group, that you're all going to be looking for jobs in the same type of areas. Let me start out with job positions within the health promotion arena in the public health sector. Positions that as you come out, a new graduate, you're going to be looking for probably are going to be things like a wellness coordinator. Wellness coordinators are going to be helping to support maybe an account manager or a consultant in the design and implementation of a program. This is going to give you the baseline to really learn a little bit more about the field and what it's going to take for you to look at a comprehensive approach in worksite health promotion. Account managers typically are going to be those people with a little bit more seniority and experience, and they are going to be leading certain customers when you look at an outside or vendor type arrangement, and may be responsible for everything from the budget of the account to the, again, planning and implementation of a program. And going to do a little bit more things like strategic planning, potentially with customers as they move on. Consultants, again, are those people that are going to have quite a bit more experience. So as you're stepping out of the field as a new grad, I would not go and look towards being a consultant. Usually those people are going to have anywhere from 8 to 15 years experience. There's positions open as health screeners, and that would be where you're going to participate with a company and actually do screenings like blood pressure screenings, cholesterol, TCH, glucose screening. So you'll be part of the company and actually out the front face to the front line of a vendor type arrangement working with the company to do biometric screenings. Health coaches are a little behind the scenes. Most health coaches do phone-based coaching, but they look for people with health education type degrees and a broad knowledge range from your lifestyle areas such as physical activity, nutrition, stress management, in a little bit of the disease management with cardiovascular disease and diabetes. Health educators are going to be probably more in a clinical setting and or a public health sector where you will be working to write health education materials. You'll be potentially presenting health education things in class formats, but really trying to reach a broader sector of people. In research, there's opportunities that can be through government agencies, through grants, through certainly the public health sector, such as your state health departments, do a lot of research. So if you like a little bit more of that detail, those are positions that are open. Shifting a little bit more to the fitness side of it, we look for professionals in corporate fitness, which is different than commercial fitness. Commercial fitness is a little bit more about the personal training, that one-on-one touch, teaching group fitness classes. Corporate fitness is going to weave in more of your health promotion where you're going to be addressing those members within the center, but also reaching out to the rest of the organization. You may be helping with blood pressure screenings. You may be organizing population-based health programs such as an 8-week physical activity campaign where you're trying to get everybody in the organization walking. It doesn't have to be in the center. It can be outside of the center. So you're really going to look to programs to enhance the membership of the centers. Is also what you're going to do to reach outside the walls of those centers. In commercial fitness, as I said, you're going to be more in a one-on-one relationship. So if you enjoy that one-on-one interaction, helping people gain and grow, also looking to help round out those skills would be good group fitness skills. Exercise physiologist, usually it's a 4-year degree. Many places will look for a master's level, and probably leaning more towards the cardiac rehab, so you're going to be more exposed in a clinical or hospital setting. Certainly there's a lot of other avenues. I mean, with the senior population exploding, there's opportunities within senior centers where they look for exercise physiologists slash trainers. Typically not as much the trainer mode, as more of somebody that can really help the senior population with things like balance and strength, so they can do daily daily skills. And then the resorts and spas, and that would be the fun job as you're out of college to be able to spend time in a great area, and again, more in that personal trainer mode, so more as a one-on-one contact with a client. So those are some of the positions out there. I know there's many more, but we only have so much time to get through all this. So let's talk about where are the jobs then. So I kind of have an idea of what the positions are. Where can I go to find jobs? Well, the first one I started with was in-house. And when I say in-house, that means you're going to be hired by a company to work within their programs. Typically, people or organizations that have in-house staff are usually larger organizations, anywhere from 1,000 plus employees. Smaller companies, that role of in-house is most typically connected with an HR or benefits position as well. So if you're looking for a minor to support the major of health promotion, you may want to look at something like HR and benefits because it will be a nice package to get you in the door. Vendors, those are firms such as Health Source Solutions that are going to provide services to companies, anywhere from screening type services, biometric screenings, to health coaching, to health assessments, seminars. They may set up health fairs for companies, fitness center management, so they would be overseeing corporate fitness centers in that realm. Vendors can be large, such as your Health Fitness Corps and Staywells, to smaller vendors such as ourselves, and there are many of us around the country. So the vendor relation, or vendors are obvious place for looking for job potentials. Public health departments. I am from the Midwest, Minnesota, if you haven't figured out my accent yet. And within the Midwest, and particularly Minnesota, our public health department has grants that service work sites. They have specific initiatives where work sites are one piece of the population, such as a cardiovascular, decreasing cardiovascular risks, and stroke. And within that, they have a community section and a worksite section. So there's opportunities in your state health departments. Our counties also have initiatives going for health promotion, and it may be addressing the entire community that that county is within, and or addressing work sites within that county to help them take the next step for health promotion. States. Many states have their own health promotion team to address all the state employees, which I can speak for Minnesota most cleanly. You know, we have close to 80,000 employees within our state, so those people help direct down to the county level programs that their counties can run for their own employees. There's government things such as the CDC or other large organizations or associations, American Heart Association, American Diabetes Association, American Lung Association. They all do types of worksite or health promotion either at a community level, public health level, and or a worksite. Health plans, especially in our region, the health plans all have health promotion staff on as part of their offerings to their clients. And these health promotion staff most often guide the companies in the next steps. Not too many plans in this area, in the Midwest region, actually offer services such as screenings, etc., but they do help the companies set that up. Now, I'm not familiar with other areas within the country, but that is something that I would encourage you to look into. Brokerage firms, these would be insurance brokers. Again, they're all hiring health promotion staff to assist their companies in taking the next step in managing their health care dollars by doing more prevention activities through health promotion. I pulled out school districts and municipalities because I think they are their own kind of unique animals, because a school district can, you know, be quite large. If you look at the Minneapolis school districts and how many schools make that up from elementary to high schools, it's typically a position within itself, and you are managing a lot of staff and a lot of people. Same thing with municipalities, from fire departments, police departments, electrical. They, again, will be more inclined to hire somebody in to help establish their program. And police and fire departments, they're going to look for somebody with a heavier fitness emphasis because they have fit-for-duty requirements that they're going to look to you to help manage as well. So if you're an exercise physiologist, that may be a place to look. Hospitals and health systems run programs for their own employees, and many of the health systems in this area also are offer, especially the screening type services, to the community as well. And then finally, the Peace Corps or AmeriCorps. A whole different way if you want to see the world and venture out. Those are certainly opportunities I'd encourage you to look at. So there's a lot of places to find jobs besides just the commercial fitness centers or at a vendor. There's tremendous opportunities out there, so really think about exploring those options. Next, how do you prepare yourself? How do you look and say, okay, I'm ready to spread my wings. What am I going to do? These are areas besides within your health promotion program that I would really encourage, if you don't get this within your degree or you have another degree and you want to expand into health promotion, that you really think about skills such as marketing, because any veteran in this field will tell you that marketing is probably the most important thing you do. You can have the best program in the world, but if nobody comes to it and nobody joins it, it's not that great a program. Sales, again, whether you're selling services as a vendor or selling services in-house in a program, understanding the whole sales process and building relationships and how you would move forward in getting people to think about your service. So having some background in at least the terminology of sales and the concepts that salespeople use. HR and benefits. Critical now at the juncture we're at with health promotion that you understand the terminology for HR and benefits, because high deductible plans, how are you going to support that within a health promotion program? They're looking for ways to embed health promotion into their benefits design. So understanding what self-insured versus a fully insured company is up against. If they are going to purchase high deductible versus a traditional plan, what does that mean, and how would your program support that? What are flexible spending accounts? Because that's, again, another way companies incent program participants is by contributing money to flexible spending accounts. And so if you're not familiar with those terminologies, I really encourage you to, if you don't take a course around something like that, really explore that so that you understand that terminology, because it's a world that you're going to live in the worksite health promotion arena. Group fitness instruction is another skill within, again, the Midwest region. I can tell you many of the graduates coming out do not have that skill, and if you want to be in any type of fitness environment, it is a critical skill to have. If you are also just wanting to break into the field of health promotion, many entry-level jobs will start in a corporate fitness center and you will grow from there. Group fitness is almost always, for us, one of the key things of an applicant getting a job over not getting a job, because if they can't teach group fitness, they just really are not part of our applicant pool. And we do run centers outside of the Minnesota area. We have centers in other states, and we run across the same thing with those centers. Exercise plans. Having the ability to be able to help set up somebody on an exercise plan is another key component. Now, if you're in an exercise physiology or corporate fitness major, this is a no-brainer. If you are more in a HR and or sheer health promotion, public health arena, this is something that you may want to consider. Last, and probably most importantly, is your writing skills. No matter what you're going to be doing, those writing skills are critical. And I would have you think about shifting from academic writing to business writing. It's very different in the respect in business writing. It needs to be short, it needs to be the point, and it needs to use the vernacular that the people that you are working with use regularly. So writing skills are critical in coming into a new position. Okay, so let's shift gears here and talk a little bit more about your internship. It will literally be the longest job interview of your life, and I can't stress enough how important it is to put a lot of thought into an internship. If you're not required to do an internship for your degree, I would encourage you to do one anyway, because the networking and the opportunities you're going to gain through your internship are going to be invaluable. When we look to interns and potential employees, we hire probably 20 to 25% of the interns that come through our program, depending obviously on job openings and their skill sets. But we turn to those people because we've spent 400, 600 hours with them. We have a pretty good idea of who they are, their work ethic, their knowledge, the skills they come with, and that is invaluable to us. So take your internship seriously. And like I said, if you haven't done one, do one. What's going to set you apart from all the rest of the people in the bunch? Those people that take initiative. If you think this is just one more class and that you're going to kind of go in and, okay, I have to write a paper, about my experience, and I have to turn in and log in my hours, you're mistakenly guided, because it is way bigger than that. That is what you need to do to get your grade, but what you need to do to get yourself the experience to be out in the field is much greater than that. So you really need to look at, what do I want to accomplish and how am I going to take initiative as I'm there? Get to know the people you work with. This is, again, critical for your networking abilities, is to know the staff and to get out. If it's a small group, have them network with other people for you. The interns that come to me and say, I want to know more about a government agency and working in the government. I want to know more about a public health. I want to know more about a hospital. I have those connections that I can link them to. So many of our interns don't realize what a valuable resource the staff are that are there. Which kind of brings me to that next bullet about asking about networking opportunities. Keep asking and getting out, because it's a prime time for you to get out and meet people when you're within your internship. Ask to observe in all areas. If you're in an environment, no matter Where it is, were you able to get out and see sales opportunities? Helping to build a budget. Do you have any, can somebody kind of share how the budgeting process goes? Marketing. Who in the marketing department could share some of the key initiatives when they look forward to a marketing plan? Have you gotten to spend time with the consultants and the account managers, and the coordinators, so you get a feel for all levels of the position? This will be, again, invaluable to you so that you can really get a feel for what is it that I think is going to make me tick. What's going to be my passion is where I want to start to look for positions. Being well organized is something that we observe regularly behind the scenes. And if things are falling off your plate, not getting done, we're not going to hound you about it. That's part of being in the business world now. You need to take accountability for that yourself. And that goes to the same thing with timelines. If there's a timeline and you're not meeting it, we're not going to be standing there hounding you about it. If it's not done at the end point, we're going to be all over you with why it didn't get done. So it's critical that you take on those self-skills. And the last thing is the staff time, the people that are there. Most environments they want, or should, and if they don't, I'd have you reconsider, but most environments should be really willing and wanting to help you grow. But at the same time, you need to be respectful of their time. So taking time to set up meetings through Outlook, when it's appropriate to knock on their door and when it's not appropriate. I have sometimes interns that just kind of expect I'm going to drop everything that I'm doing so that I can answer their question and, do something for them. And I have a whole lot of other things on my agenda, which is customers are first, that I'm going to focus on. So really think about the staff time and find out from them respectfully how they want to be. When is the best time to meet with you and the best way to communicate with them. Okay, looking at internships, things to consider. When you're looking at your internship, I would have you step back and say, okay, where do I want to live and what interests me most? If you, and there's people I'm certain that will think opposite of me, but I truly believe that the networking opportunities you can build through your internship are invaluable to helping you get a job in that area. So if you really want to live and work in California, do your internship in California. Boston might be a great city and a fun city to experience. However, if you don't want to live there, you've lost a tremendous networking ability to being on the other coast and knowing how things function on the other coast. I'm all about getting out and experiencing things, but I do believe that you will have a better feel for the environment if you spend time there. What interests you? Sometimes it's easy to just go, oh, I'll just go get a job at this, XYZ club because it's easy and I'll just get this done with. Well, if that's not where you want to spend your time, if you're applying to a position as a coordinator and you've just been out in the center and have never experienced coordination, we certainly aren't going to look at you. So your internship is the way for you to build your resume with the things that you learn. Which leads to me, you need to step back and think about what are your goals? What do you want to do? What are the areas that make you tick? What organizations are going to help you meet that? So if you really want to do bigger level public health type work, I wouldn't recommend you go to a small organization that's dealing with an in-house program or a program that's very contained, because it's really not going to give you the feel of a public health type arena. I'd go to more of the associations, the lung associations, a government, or a public health, state public health site. The hours that are required for you, consider strongly. Now, some of the schools that we work with have quite lengthy internships. 400 to 600 hours is pretty standard around this area. I know other areas it's different. I will tell you that we, as our organization and many around us, don't accept interns for much less than 400 hours. And the reason is because you don't get to experience the environment, the staff, and what it's really like to be at this position. There's so many things that you miss out on that we feel like it's not a good experience for you. Ask in your interviews, what are your responsibilities? If you wanted to work longer, what would that mean? find out information or the reputation of the organization so that you can go into it with knowledge about who they are and what they do. How do they treat their internships? Do they have an idea of how many of their interns are placed in outside once they leave? Because those are all things that are going to be important as you hit that job-seeking world. The whole search piece of it, again, it's just building your networking, whether it's advisors, your career campus centers, organizations. I have a list of professional organizations here. Your company websites, going out to find out, hey, I want to know a little bit more about company Z, and if they have health promotion, and gee, maybe if they have health promotion, they possibly would take interns in. And don't forget about things like family and friends. They have wonderful connections that you may not even be aware of, so network and ask. As you go into that interview, I said this a little bit before, but know what your responsibilities are. Ask what the organization's responsibilities are to you. What are your goals? Have them thought out and be able to explain them to the advisor. What type of projects might you work on? This is the point where you're going to build your resume. I'll say it again because it's so important that you need to really take this opportunity to build a good resume. If you are already out of school, you don't necessarily, you're not kind of sure how you would do an internship, you can always go and ask a company about an internship, probably leaning more towards an unpaid than a paid internship, but it's never too late to do an internship. I decided to call these my personal pet peeves because I believe many people would support me on this. Things that turn a job interview possibility off very quickly are when I receive emails with misspellings in them, slang, the punctuation isn't there, they write it as if they're texting somebody. Not appropriate when you're trying to communicate in a higher level. Same thing with written communication. In that body of that resume letter, we look for things like, what are the skills you're bringing to this job? It's not like I'm great, I'm great. We want you to sell yourself, but we want to know what is it about you that matches to this position or this job. Same thing with phone etiquette. I have many applicants, whether it's interns or other, that will call in and they speak very quickly. They don't leave a phone number for me, or they just leave an email address. I'm trying to figure out who they are and why they're calling. So really step back and think out. Don't ramble on the phone. Here's what it is. Leave your phone number, leave it a second time, and speak distinctly so that people can understand you. I will tell you many applicants and or internships never happened with us because we couldn't get that information, and we're not going to hunt it down. So here lastly, and I believe this will be posted, you can go out and look at professional organizations that support the worksite health promotion and public health arena. I really focus this much more towards worksite health promotion and fitness center services, and not quite as much towards the public, not really quite at all towards the public health arena. They have a whole different sector that they typically connect through. But IAWHP is an International Association for Worksite Health Promotion, which is right now linked through ACSM. WellCOA is the Wellness Councils of America. ACSM, again, is just the American College of Sports Medicine. HERO, the Health Enhancement Research Organization. NETA is the National Exercise Trainers Association. National Strength and Conditioning Association is the NSCA, I should say. Then there's the Health Promotion Advocates and the National Association for Health and Fitness, ACE and IDEA, which are more towards those certifications for club settings. Go out, check out the websites, get a better feel for who they are. Some of the professional conferences that you might want to consider would be the ACSM Healthy Summit. That includes both fitness and health promotion within it. American Journal of Health Promotion, again, much more public health sector and focused on, well, both worksite and public health. HERO is an organization that's much more on research and outcomes. The National Wellness Conference is held in Stevens Point every year, and very broad range of topics from both personal wellness to professional wellness, corporate wellness. It's a wide range of things. Institute for Health and Productivity, again, much more research focused. And then Cooper's Clinic, not as much a conference as classes and trainings that you can take. Again, there's many more professional organizations I have not, I missed in this and or maybe not as familiar with. So please research it, ask, network with your professors, advisors, people in the field, and ask them, what organizations do they belong to and why. So I'll close this and wait for questions now. In your job search, connect through networking, your career centers, professional groups, company websites, and go into an interview understanding, especially a job interview, hourly annual salaries. And I say that because you might have in your head, okay, well, I really want to make, whatever, $16 an hour. And then they come forth and say, well, this position is, $38,000 a year. And you'll go, uh-oh, because you didn't make that connection. Benefits, depending on the region you are in the U.S., can range anywhere from probably 20 to 30% of your salary. So understanding the benefits and how much they are worth to you can be a real hindrance and or, on the other side, a very positive thing in getting a job. What are CEC opportunities that they offer you as part of this position? Are you going to be your ability to grow and understanding your personal time off, vacation, sick time, etc. Because you may think you want to go in with a 3 or 4 week vacation and standard is going to be 2. Again, very variable around the country. Questions?
Great. Well, Mary, thank you for that presentation, and we will definitely now take questions. This is a reminder. There are 2 ways to ask questions. The first is to raise your hand using the hand icon on the left side of the toolbar. And if you select this icon, I'll unmute your phone line so that you can ask the question via the phone or your headset. Or you can just type your question in the question portion of the toolbar, and I will read those. So this is your time to ask anything and everything that you want of Mary related to the field or her experience. So just starting with the ones that have come in your experience, is it better to go for a master's degree right out of undergrad, or should this individual get some work experience first?
Double loaded question there. Experience is always great. Because of 2 things. One, obviously, it gives you a better feel of the field. Secondly, it will potentially drive you maybe in a different direction. I say it's a double-edged question because if you're in something like exercise physiology, having a master's degree may help you get that job in that cardiac rehab setting over somebody with a bachelor's degree. I would think about what you're doing and what sector you want to be in, and then do a lot of informational interviews and find out what's going to be most expected from you in that particular field. Again, public health people probably need an MPH to be one of the front runners in a job. Worksite health promotion, many people out there with bachelor's degrees.
This is somewhat related. What undergrad majors are the most prominent among the recent grads that you hire at your company?
We have people with corporate fitness degrees, health promotion, community health. The University of Minnesota has what's called a kinesiology degree, which we hire those people. It's not probably a preference of the degree we would look for. We have people with exercise physiology backgrounds. So it's really quite a variety. We have health education staff as well.
Great. The next question that we have is, what is a typical day like for you?
Oh, boy. Let's see. Well, because I'm over a company now, I obviously spend time in a lot of the sales and networking things. I oversee staff and so there's going to be the day-to-day operations of hurdles that the staff have come across. It could be personality issues as well that we may be trying to interact with. I do development, so I do a lot of writing for both professional publications as well as programs. Let's see, what else would be a typical day? I do a lot of running around with like a chicken with my head cut off because we always have 10 balls in the air and we're trying to continue to keep them all moving. We do hiring and staffing. So really quite a variety. If I think about what an entry-level person or one of our wellness coordinators do, they spend a lot of time helping program development. They work in coordinating screenings and health fairs for companies, so they're going to have a lot of company interaction, whether it's face-to-face or phone. They're going to be working with our screening staff to help connect the screening staff to getting to the company on time, and that can be everything from providing directions, getting equipment to them, etc. They write programs for us, so it could be company communications, maybe email communications. They may set up programs around a national health observant. They write what we call behavior change campaigns, which would be like lifestyle education programs. It could be stress management, nutrition, forward nutrition campaign where people are going to focus on eating fruits, vegetables, and grains. Well, they would write that program, the content for it. So quite a variety of jobs.
The next question comes from Stephanie, and she says that she has a second interview with a new company doing health promotion. However, they want to be independently contracted, and she'd like to know, is this normal?
I think for smaller companies and vendors, yes, it seems to be more of a common practice. For established companies and companies that have larger employees, no, it's not as common. Having those benefits is a real key, and companies understand that it's very difficult as an independent contractor then to have a good benefits opportunity, especially around health care.
Okay, and the next question is, how has the economy affected professions in these fields, and is the job market improving or declining, I guess, in this industry?
I will first start out by saying that health promotion is absolutely at its pinnacle. Companies are finally, and their data is to support that this works, that we have to prevent health issues. We can't continue to try to treat them. The medical care, the cost is escalating much farther or much quicker than the gross product, so there is a huge deficit that companies are finally realizing we got to take care of our people. I will honestly say, this is probably the third recession I've been through since I've been in this field. We have not felt this recession like we have past ones, where the first thing that got chucked out the door was the health promotion program because it was perceived as fluff. This time around, companies understand that, whoa, we can't get rid of this. It helps retain good employees. It's helping us get through these tough times. Are they adding tons of things? No. Are they taking away a lot? No. So they're continuing to manage the programs they had. So in light of that, is the job market falling apart? Not really for health promotion professionals. Is there tons of new jobs? Not as of yet, but it was growing so quickly in the last 24 months or 2 years, health promotion positions. Because of that, it has slowed dramatically, but companies, especially those national vendors, are continuing to maintain the staff they have, slower on hiring.
Great. The next question is related to hiring. This individual says that they're an underemployed health educator with an MPH and 15 years experience. Do you have information on how to go about contacting headhunters?
I am not the greatest person to help you on that as far as headhunters go. I think the region that you're in is probably going to make a very big difference as far as the health, your status and the job opportunities out there. can't help you with the headhunter. I apologize.
The next question we have is, what are starting salaries, average starting salaries in the various fields that you mentioned?
Okay, this is a difficult question to ask because regions within the country vary so much. And I'll share an example. In the Midwest here, you're probably looking at an average salary starting in the low 30s, moving up to the mid 40s with 5 or 6 years experience. From that would be more the fitness center professionals and worksite coordinators to an account manager. Because of the cost of living in other places, that could be closer to 40 to 50, mid or beginning 40s to mid 50s, because the cost of living is so much greater. You can go and search on the web, and it's escaping my mind right now, but you can actually plug in different areas of the country what the job is and the average salaries for those jobs. I'd be cautious about looking at personal trainers versus wellness professionals, because a personal trainer, it can range from those people that are just beginning in the field at $10,000 a year to those that are very well established and have a very high level of clientele, can make in the 6 digits. It takes time to get there. Don't expect to come out of school making $60,000 or $70,000 as a personal trainer unless you have a pretty big clientele base built up. So I would tell you, in this market region for the Midwest, again, probably low 30s to high upper 30s for your fitness positions. Same thing for your wellness coordinators. Once you get into more of the public or the private sector and get into the account management level, you can certainly make in the mid-60s to lower 70s.
Great. Our next question is a little bit of a longer one, but this individual has been a group fitness supervisor and taught for 2.5 years, and a personal trainer for a year, and helps direct some of the special events for the wellness at the University Sports Recreation Sports Center. And it says that he's required to do a 300-hour internship before graduating with his bachelor's in health promotion. How does he list job experience on a resume without sounding that he knows everything, which he doesn't? Would this be in the cover letter?
I would put it in the cover letter, but I'd also call out, that your experience in teaching group fitness, and then like the types of classes and range of classes that you know how to taught. That certainly isn't, you want to sell yourself. The other thing would be with, the experience in the fitness realm, you have stronger. If you're looking to get a broader experience with your internship, I wouldn't worry about the fact that you don't have experience in a particular arena, because that's the whole idea of an internship. And if a company in their internship program is looking for people that already have skills, then I'd question if it's really a true internship or if it's a way to get labor in for less expensive, because my concept of an internship is that it should be a time for you to broaden your arena and your knowledge and not be stuck in the things that maybe you have some experience with.
Thank you. Those are all of the questions that have been submitted by participants, but we do have one, since this is an ACSM webinar, we always ask is, how has your involvement in professional associations been beneficial to your career?
I think they've been critical for my career as far as growing. In the front end of my career, the knowledge base that I gained from being, I've been an American College of Sports Medicine member for just about my entire career, which would be 25 years. I was also involved with the National Athletic Trainers Association because I'm an NATA certified trainer, so that particular knowledge. The Association for Worksite Health Promotion, which is now the International Association for Worksite Health Promotion. I've been very engaged in that. It's invaluable for gaining new knowledge, keeping abreast of the field and what's happening in the field, for networking opportunities, and just collegial connection, to be connected to other people and hear what they're doing is just, that's the place that you get that. So getting engaged in a professional organization, especially as your student because they're typically cheaper, it's a wonderful way for you to really gain a feel of the field and potentially many areas within that field.
Great. Well, at this point, those are all of our questions. And Mary, I'd just like to once again thank you for your willingness to share with the students a lot of great information. We really appreciate it.
You're very welcome, and good luck to all of you.
As a reminder, ACSM will offer new Career Spotlight webinars each month, so please be sure to visit the ACSM website at www.acsm.org for a list of future offerings. This concludes today's event. Thank you very much for participating, and have a wonderful day. Mary, are you there?